and S stands for shift of white blood cells to the left. Okay, so let's go. If there's a migration of pain to the right iliac fossa, we give a score of 1. Anorexia also has a score of 1. Nausea and vomiting also has a score of 1. Tenderness at McBurney's point has a score of 2. Rebound tenderness also has a score of 1. Elevation of temperature also has a score of 1. And leukocytosis, or increase in the leukocytes, has a score of 2. And a shift to the left side of the white blood cells will have a score of 1. Okay, like I said before, patients come with signs and symptoms. Okay, not all patients come with all these signs and symptoms. Some might be present, some might be absent. This Alvarado score has a score of 10 in total. Let's count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so it has a score of 10. But sometimes we don't get all these signs and symptoms, so we don't end up getting 10. So let's now go and interpret what this score is. So over here I'm going to write the Alvarado's score. I'm going to interpret for you. A score of 1 to 4, if you do all these tests and then you score 1 to 4, it means that there is no appendicitis, but you should do further investigation and keep the patient under observation. A score of 5 to 6 means there is possibility of appendicitis, but still keep patient under observation and do further investigation. A score of 7 to 8 means that there's a possibility of appendicitis, so you should do surgery, you should operate. And if you get a score of 9 to 10, this guy should be taken off. This guy has to be taken off. If you get a score of 9 to 10, don't waste time. Quickly do surgery. So 9 to 10 means there is acute appendicitis and you should do surgery. So we are done with investigations. Complications. Yeah, I was telling you a story. So when this guy becomes, the walls of the appendix become very thin and become very weak, what happens? They tend to lose their strength, and within 72 hours, if medical care is not being given, this guy ruptures or it perforates. Okay, so complications. Complications, we have perforation, or rupture. Sorry. So it ruptures or it perforates, and then it will spill all of its content into the abdominal cavity. Remember, it has a lot of feces, a lot of pus, a lot of bacteria. Okay, so it's going to release all this content into the abdominal cavity, and it's going to infect the serous lining of the abdomen, known as the peritoneum, and that is peritonitis. Is going to cause inflammation of the peritoneum, known as peritonitis. Okay, now at the site of the rupture, or at the site of the perforation of the appendix, there's going to be collection of a mass where this guy perforates, known as abscess. Abscess. So this abscess formation We also have pylophlebitis. So guys, you see, this appendix looks very cute, very small and cute, but when it gets angry or it gets irritated and it becomes inflamed, it can cause a lot of problems into the whole of the abdominal cavity. How do we manage or how do we treat acute appendicitis? We are going to go by, okay, I can clean this one. With the management, we are going to go by pharmacological and non-pharmacological treatment or management. Pharmacological, we give the patient fluid IV wise, because the patient comes with vomiting and they tend to lose a lot of fluid. They become dehydrated. So you want to replace the fluid that has been lost during vomiting. You give them fluid IV wise. You also give them antibiotics, okay, because there's going to be infection. You give them antibiotics, and you also give them sedatives. That's before the surgery. And then non-pharmacological treatment, is appendicectomy. Either you do an open appendicectomy or you do laparoscopic appendicectomy. Remember that appendicitis is an emergency case, okay, and it has to be treated very quickly. You have to act upon it sharp. Just give the shotgun and then take this guy off. Okay, so you have to take this guy off because it's very inflamed. So the optimal treatment for appendicitis is appendicectomy. Either we do an open appendicectomy or laparoscopic appendicectomy. So that's everything or summary of acute appendicitis. So at the end of this lecture, we've learned that acute appendicitis is the inflammation of the appendix. The etiology is lack of fibrous diet, obstruction, infection, and also lymphoid hyperplasia. Okay, pathogenesis. When we don't eat food that have fiber in them, they tend to cause our poop to be very hard, and then sometimes this hardened poop or fecalith gets stuck in the lumen of the appendix, causing pressure, and there's going to be increase in production of bacteria in the lumen of the appendix, and mucus being secreted is being trapped. It has nowhere to go. This pressure keeps on increasing and increasing. Okay, edema sets in, then the blood supply to the appendix also becomes occluded. What happens? It becomes ischemic. The ischemic or the ischemia of this appendix causes gangrene. It loses its function, and the walls become very thin and they become very weak. Within 24 to 72 hours, if care is not being taken or if medical advice is not being sought, this appendix becomes perforated, spilling all of its content into the abdominal cavity, okay, causing some complications like peritonitis, okay, and there's going to be formation of abscess around the site of this perforation. So some of the symptoms, we have periumbilical colic, radiation of pain to the right iliac fossa or right lower quadrant, fever, nausea or vomiting, anorexia, tenderness and guiding. And there's one more thing I forgot to tell you about the lymphoid hyperplasia. When there's an infection, okay, the lymph nodes inside the appendix or the cells, the lymphocytes, they tend to increase in number to fight this infection. They proliferate, they increase and they multiply. And this increase in number without control is known as the lymphoid hyperplasia. Also causes obstruction of the lumen of the appendix. So, with the management, I spoke about appendicectomy, either open or through laparoscopy. So now that we have a bit information, if not everything about appendicitis, at least we know what appendicitis is and we can answer some few questions